Hello, my name is Stephanie Coles. Today I would like to speak with you about prescription drug use and correlation to addiction. We have all seen and experienced the opioid epidemic here in the United States. With that said, as healthcare professionals, do we see a correlation between the amount of prescribed opioids with the epidemic we face today? An article by Andrew Kolodny shows that over the past 15 years, the rate of opioid pain relievers prescribed in the United States has soared to an all-time high. The rate of hydrocodone has more than doubled, while the rate of oxycodone prescribed has increased nearly 500%. This is an alarming rate of increase, leading to the worst drug epidemic in U.S. history. To understand how we have entered into this epidemic, we will look at history, euphoria, and why the alarming increase in prescribed opioids. First, history shows us that in the mid-1890s, opioid consumption was up over 583%. Also, due to lack of medical advances, doctors prescribed such drugs as opium and morphine because they had few alternatives. Finally, poor control and sale of narcotics during this early period led to patients using these drugs outside of medical care. We ask ourselves, why is history repeating itself? Euphoria is induced by the use of opioids. As street slang would say, people experience that high feeling. Euphoria is seen as positive reinforcement, causing one to enjoy and seek this feeling. This creates addiction because withdrawal of the drug enacts negative reinforcements, also known as dysphoria. Most every individual would rather experience a good feeling versus a negative feeling. Chronic use or exposure leads to structural and functional changes in the brain that affect impulse, reward, and motivation, thus continuing the cycle. If we continue this cycle, it will be harder and harder to break. Will the cycle ever be broken if we continue to prescribe opioids at an alarming rate? Can we break the cycle and how it impacts us as healthcare professionals? For healthcare professionals, we can understand that the use of opioid medications are essential to the treatment of patients. When does this cross the line of overprescribing versus medical necessity? Also, current research shows that the states with the highest addiction rates are among the highest prescription rates. This outlines how prescription medication correlates with addiction. For everyone to understand, we use research listed by Kolodny showing the sharp rise in opioid prescriptions when pain became adopted as the fifth vital sign. This was done in part because earlier research has shown that pain was often overlooked and not treated, thus encouraging physicians to use opioids as a means to treat pain. Can some, not all people, be treated without the use of opioid pain medication? We have many drugs on the market that can be used to treat this fifth vital sign known as pain. Why is these drugs not more commonly used? In conclusion, we see that history is repeating itself here in the United States with soaring rates of prescription opioids. Is euphoria the leading cause of drug addiction? Do we see this addiction due to the euphoria experience from first prescribed opioids, then street drugs? Pain is the fifth vital sign, and now being treated by opioids, that is leading us further into the worst epidemic in U.S. history. With today's medical advancement, it stands to reason that we can find alternatives to treat pain and use those alternatives to effectively give patients better outcome. When we see patients using prescribed opioids for euphoria versus actual inflicted pain, we know that we have crossed the correlation between addiction and prescription drug use. Thank you.